There used to be a time when we used to do a specific calculation of 100 plus age divided by, so then that is by 2, and that is to be the accepted blood pressure for a person. So if it was 60-year-old, then 120 plus 60 by 2, that is 30, so 150 was an acceptable blood pressure.
Dr. Saab, what should be the normal blood pressure for a patient, for a person like me? I wouldn't say I'm a patient, for a person like me who's 65 plus. And what is this to do with hypertension? Does it normally happen to people like of my age group?
Yeah, a normal blood pressure for any person at this point of time, as per the new recommendations of the various guidelines, is basically around 130 on the top and 80 on the bottom. There used to be a time when we used to do a specific calculation of 100 plus age divided by, so then that is by 2, and that is to be the accepted blood pressure for a person of that 120 plus age divided by 2. So if it was 60-year-old, then 120 plus 60 by 2, that was 30, so 150 was an acceptable blood pressure. Today we know that that was a wrong calculation in those days. So we know that BP blood pressure of 130 by 80 is what is acceptable for all age groups. Having said that, there's something called as isolated systolic hypertension of the elderly. What is that? The upper blood pressure goes up and the lower blood pressure goes down or is normal. Why? Because as we grow older, all our arteries get thickened and calcific.
Okay.
So the collapsibility of the artery and the distensibility of the artery becomes affected. So the upper blood pressure tends to go up to 170, 180. The lower will be about 70, 60s, 80 and in this range. Is that acceptable? No, it's still not acceptable. We need to bring it down. But we need to bring it down slowly. Because these patients, when you bring the BP down to 120 and 130, they'll have certain symptoms of fatigue, giddiness, tiredness, weakness. Why? Because the brain is already used to that 170, 180 and they require that pressure to maintain the circulation to the brain or organs because all the arteries are a little diseased. So we need to be careful when you bring it down to about 130, 140, 150 and see how they maintain themselves. So hypertension is any blood pressure beyond 140 by 90 needs to be treated. Between 130 to 140 in the top and 80 to 90 in the bottom is somewhere we can try all your lifestyle modifications and see, and no medications are necessary. But moment it goes beyond 140 by 90 with lifestyle modifications, with dietary restrictions, with all your other exercises and yoga and meditation, etc. If you can do it, if the BP remains high, the doctor will put you on medications.
Yeah.
Okay. So that's what determines the blood pressures. But even at any age, a blood pressure of 130 by 80 is considered as normal.
Okay. Thanks, Dr. Saab.